Assalamualaikum and a very good morning for those watching this video. I would like to say thank you for your time. Since we cannot make a presentation in the class, since this is the only channel we can do, I hope that this is the only that we can connect and interact to each other, keep in touch to each other through social media. I hope you guys are in the good condition as well. Don't forget to always take care of yourself. Don't forget to wash your hands regularly with soap, and if you are planning to go anywhere, don't forget to wear face masks and hand sanitizers as well. As for introduction of today, I would like to introduce myself. My name is Fatihah Ramli, and I was so being pleasure to share with you guys some tips or strategy on how hospital managers are recruiting their new staff, and what are the capability they look for the candidate, what are the things they want in someone to be absorbed in the organization. As we know that hospital managers have a very little direct communication with patients, but their work is constitutionally tied to policy changes to improve patient care. Since the hospital is 24/7 institutions, the job requires long hours, site visit, working weekends, and being able and be on call to handle urgent issues. We ensure the hospital to run efficiently while serving the needs of the community and meeting financial goals. In today's competitive hiring environment, hospital must do all they do to attract, retain, and develop their workforce. Especially populations and their associated healthcare needs grow, develop, and developing countries alike are struggling to source, attract, and retain sufficient numbers of trained and qualified healthcare professionals such as physicians and nurses. As additionally, hospitals and health systems needs employees to have a new balance of skills such as an advanced nurse practitioners, physician assistants, medical technology specialists, and IT experts for standardizing and integrating and standardizing data from multiple sources. Hospitals are just like any other organization that has its own recruit process. Recruitment refers to the process of identifying, attracting, interviewing, selecting, hiring, and onboarding employees. In other words, it involves everything from identification of a staffing need to filling it. There are some of the process we will work on for the candidate, and the procedure must be in detail so that it will be run smoothly. We have provided the process through cloud technology with application and hiring providers with a simple and intuitive process that emphasizes mobile first strategy. Healthcare organizations are concerned with managing the process of screening candidate with consistent, simple, and faster. Proper assessment of skills is crucial to ensuring the best consideration of qualified applicants. Most importantly, do not be too rushed in arranging the recruitment process, as it may increase the chance to hire an employee who isn't a good fit with the position. We have provided peer interviewing for everyone who will be working with the candidate, so they can decide whether they have a good choice for the department. When hiring staff members who do not fit with the organization's missions, visions, and values, we will face a severe negative effect on the hospital in the long term. Besides, we will assign mentors to advise new employees for the first couple months on the job. In addition to providing practical information, these mentors can help new employees learn the little nuances that vary from hospital to hospital, such as the preferred way to communicate with other departments. Ongoing training is an essential aspect of improving employee engagement, whether employees work in clinical, administrative, or support functions. Ongoing training are more focused on positive management techniques which can help the supervisor feel more confident and employees feel more appreciated and supported. At the same time, experienced supervisor can benefit from their learning with the new techniques and methods. We offer a better compensation in order to stay competitive. Among compensation offered are sign-on bonuses, relocation assistance, free medical or dental insurance, paid travel allowance, mobile plan, and increased maternity leave or caregiver time, especially for female employees. Nowadays, female employees comprise a continually proportion of the healthcare workforce, and this trend is expected to continue. Naturally, such criteria differ from country to country. For example, fully paid maternity leave is mandated by law in countries such as Spain or Germany. So in these countries, maternity leaves does not act as a differentiator in employer branding. However, the procedure for recruiting the physician must be implemented with a few things. The selection will be conducted through initial telephone interview, and ensuring the information collected should be beyond the training and medical experience. Keep in mind to learn what types of patients he or she desires to treat within the specialty he or she has. We prefer to attract work experienced workers to the job in the first place, as it is important for the hospital to build pathways to strengthen workers' experience. Nevertheless, the team make an arrangement by scheduling on a day to meet the physician for the site visits. Hereby, you have time to genuinely talk without much mental distraction. Always remember that the candidate is absorbing as much verbal and non-verbal information possible. We also need to show genuine interest in the candidate as well. The officer who led the tour should know where exactly to take the physician. The physician can see where his or her patients will be treated, and the officer will bring the physician to the ICU and ER as well as the laboratory to talk to the pathologist about turnaround times, and stop by the ready room in radiology. So the radiologist can tell the candidate about the procedure they do and read times. So from here, candidates can get a glimpse through the visit for the coming ahead of time, so they can prepare. Whether you're starting up a replace or a practice or replace a new worker, you need to hire strategy so you can find the best staff and have time to do what you do best. Whatever hospital does, whether making new policy, hiring new staff, using new and advanced tools, the focus should be on the patients. We want to give our patient the best they can have here. When the hospital learns to manage the patient, take care of their needs and deal with them, therefore the management becomes perfect. There is no management at all if you have an advanced the best and the most advanced tools, well-educated doctors, but the patients still suffering. That's all from me. I hope you are enjoying. Thank you for listening and have a great day today. Bye.